So I'm Rachel Prusynski. I'm the new vice chair of the Stroke Special Interest Group and a PhD candidate in rehabilitation science at the University of Washington. I have an NCS and was a kind of a jack of all trades PT for about 7 years full time before going back for my PhD. And I have Kirsten McCartney here, who is also a PhD student, and we were going to just chat about our journey to deciding why to go back for a PhD.
Hey everyone, I'm Kirsten McCartney. I'm currently a PhD student at the University of Delaware. I just graduated in January with my Doctor of Physical Therapy, also from University of Delaware. And I worked for about 5 years before making the decision to come back for my DPT and then continue on to the PhD route. And I'm a member of the Stroke SIG.
Thanks. So I think we also both have pretty different research interests, which I think is kind of interesting because we both have a neuroclinical interest, but that can take you to kind of different research directions in a PhD. I personally do health policy research, and I do it with a lot of large data and stats and stuff that I didn't really think about when I was in the clinic as being kind of its own research area. And Kirsten, you sounds like you do a little bit more like straight up neuroclinically relevant research. So tell me about
that. So the lab I'm in is neuromotor and sensory motor behavior lab, and focus a lot on people with stroke. And I'm interested in exercise, fitness, and sport for all people with disabilities. So I really do enjoy where sport and neuro kind of intersect. So the whole adaptive sports realm, and that includes obviously people with stroke is kind of my jam.
So for students, and maybe DPT students who are considering a PhD, so I worked, as a PT for a long time, and that was, largely a financial decision, because I know for a lot of people, even if, most PhD programs do give you, a stipend and pay your tuition, for me, I needed, like a lot of DPT students have student loans, and the salary is definitely a big pay cut. So that was part of the consideration for me. So I don't know, tell me about your consideration for going straight from your DPT to the PhD and how you made that work.
Yeah, so like I said, I actually worked at the Shirley Ryan Ability Lab as an exercise physiologist when I was living in Chicago after my undergrad. And so for about a year, I was 100% clinical. And then about a year in, I was able to get a part-time research position. So I went down to about 8% in the clinic, 20% doing research with Miriam Rafferty, who actually had a similar path to you, worked in the clinic for about 7 years and then went back for her PhD. So that was kind of my more exposure to research within the field of physical therapy. And it was kind of immediate for me that I loved how I got to take what I saw in the clinic and turn it into questions. And I loved how my brain worked kind of in that opposite way. So I had kind of already been thinking about the path towards PT school, and kind of just sat down with Miriam and then talked to a few other PTs that I worked with at Shirley Ryan, just those who were straight clinicians, those who were about 50-50 as far as being a research PT and a clinical PT, and then a few others who had gone on to get their PhD. And so I was just trying to better understand where I felt like I fit the best into the whole picture, because I really believe it takes the whole team. And for me, it was kind of like asking those questions, being able to kind of pursue that was really where I wanted to go. So yeah, I did know entering PT school that for me, it was kind of the straight through route. And with that being said, I did question that throughout my time in PT school, and even to the point of I don't know that I definitely want to go for the PhD. Ultimately, for me, it's definitely the right route. And I mean, financial is certainly I also had a salary and then cut that to go to PT school, which is no salary. And so now I'm back to at least having some sort of income. But, I think long-term down the road, salary will come back. And I just think it's really important to do work that you feel like you're valued and that you enjoy and want to pursue. So I know that will come, even if it's coming slower than it is for a lot of my peers.
Right. So does that mean that you will have a shorter PhD journey than most folks because you kind of got to lump it all together? Or are you still looking at 4 or 5 years of a PhD after your DPT?
Yeah, so I was able to take about 2 classes. They're still technically separate degrees, so it's more of a consecutive degree program rather than dual degree, just so that I could have the PT degree conferred, so I could, work in the clinic and practice as a PT, which is nice because I can work per diem, and so that's another way to get kind of a little bit of financial flow. And just honestly, I love being in the clinic and kind of keeping my feet wet in the clinical world. I think that's really necessary for researchers to really be up to date with what's happening in the clinic and be really close in touch with their clinical peers, because ultimately by making the decision to choose research, like I'm undoubtedly having less reps as far as seeing patients than my colleagues will. And so for me, it's important to kind of be down there as much as I can. But yes, to answer the question, the PhD here could be about 3.5 years at its quickest pace, 4 years at most with that. So we'll kind of see from there, like changes that could happen there.
Yeah, I think you speak to something that I've talked to students about too, who are interested in a PhD. Like clinical experience makes you a better researcher, hands down. And I am personally a little suspicious of people who have like no clinical experience and then go straight from a PT, DPT to a PhD. And that can be hard with some of the newer like dual programs, DPT, PhD combined. So it's cool that you had some clinical experience early and then PT school, because I found like, I knew I was interested in research in PT school, but I didn't have nearly as many questions as I do now after working clinically, or the experience to like contextualize, especially now that I do health policy research. I had no idea how health policy impacted clinical practice until I practiced. So I do think like it is a hard track to go straight through without a lot of clinical experience. And I think you get a little bit more street cred as a researcher who's had some clinical background. It doesn't need to be the 7 years like me. That was mostly like a personal life trajectory decision. A couple of years is usually like enough to probably get some sense of challenges and questions that need answering. But I always encourage students to have some clinical background before they consider a PhD.
Yeah.
Well, other than that, I think that we'll try to keep it brief for students that are watching and interested, but I'll post our contact info if any students want to get in touch with either of us.
Don't hesitate to reach out. And I think just something to keep in mind too is everyone's path is different. And if you're thinking about doing a PhD, then I think, just like you would with clinicals, reach out and try and get some chance to, it's not shadowing, but you can ask, why did they go that way? What was their path? How did they get there? And kind of pick the brains of a few other people to see if maybe it's something that you'd be interested in doing, whether it's straight through school or taking a break, kind of getting those clinical reps before coming back. But there's no singular path, so just keep
for sure. Do your research if you want to be a researcher. I definitely agree. And choosing a program for the same reason, you definitely want to see what people are doing, who's out there, and what their job is like before, like you did before PT school.
Yeah. Yep.
All right. Awesome.
All right. Thanks, guys.